I request President Mr. Mila Jaydev to welcome Mr. Naresh and Dr. Suman with a plant. I request Mr. Ravi Kumar, Vice President of FTCCI, to present a plant to Dr. Suman Tadagonda. I now invite Mr. Mila Jaydev, President of FTCCI, to deliver the welcome address.
A very happy good evening to all. My warm welcome to Sri Naresh Kumar Garu, Paidimari, co-founder and director and Sure Health Spine Private Limited. Dr. Suman Tadagonda, specialist in spine movement and Atlas Health and Ensure Health Spine Private Limited. My colleagues Suresh Kumar Singhal, Ravi Kumar Garu, Vice President, Shekhar Agarwal, Convener Healthcare FTCCI, and Managing Committee members and past presidents, total FTCCI Secretariat, all the members, welcome for here. For your health purpose, we are conducting a meeting. Because of that, the spine is more important when you are sitting in the chairs and the spine's problem will come. That should not come. Because of that only we requested to doctor give the suggestions. Good evening and welcome to the workshop Integrated Spine and Movement Health. In today's fast-paced world is frequently neglect the core element of our physical health of our spine. The spine not only supports our body but also enables us to move, work and engage in the activities we love. Today, we are here to explore the integrative approach to spine and movement health. This means combining the best traditional medical practices with the complementary therapies, creating a holistic approach that addresses the body, mind, and spirit. Such comprehensive view crucial talking the multi-faced health issues we face today. The workshop brings together to diverse the group experts from doctors and physical therapists to wellness coaches and alternative medicine, and each of you brings unique insights and expertise that the invaluable in our shared mission promote better spine health and overall movement. And Dr. Naresh and Suman Garu, I am confident that your insights will be inspire and educate us all, providing us with all practical tools to improve our health and the health these we serve. Your presence, your today's treatment, to our dedication to better health and better life, the knowledge gain and contractions you may hear will instrumental in our journey toward optimal health. At FTCCI, I firmly believe that healthy community is productive and prosperous community. By supporting initiatives like workshop, we aim to foster culture, health, and wellness that will benefit to individuals, families, and businesses, and the society as a whole. As we embark the today's journey, I encourage you to all engage family, ask questions, share your experience to take full advantage of the wealth of knowledge that surroundings you. Let us work together to build a future where spine is movement, health, and understood, accessible to all. I very much thank you very much for sitting here without spine pain. Thank you.
Thank you, sir, for your warm welcome. Now it's time to delve into the core of our workshop. I invite Mr. Naresh Kumar Pagdimari, co-founder and director of Ensure Healthy Spine Private Limited, to talk about the introduction and need for preventive spine care. So please welcome.
Hello. The whole workshop is to avoid sitting. The second the file. Second file on there. Hello. Hello. Yeah. A very good evening, one and all. Andariki namaskaram andi. Thank you very much to Sangeeta madam first. I mean, my first official access into this building was with an introduction from Miss Sandhya from American Chamber of Commerce, Hyderabad chapter. She connected me to Sangeeta madam when she was as a director. I mean, as a growing kid, I know FAPSI, but FTCCA was known to me only last July during the Excellence Awards, because one of our known people's company got an award there. And then I was in that award ceremony, and it was very vibrant. And very honestly, madam, that day I thought, okay, I should somewhere get an opportunity to work with FTCCI, because for any problem there is a top to bottom and bottom to top approaches. But I felt spine should always be from top to bottom, because we all go from a head to toe rather than toe to head. So naturally, well, thank you madam, but as an officially, and I'm very thankful, I saw once Shekhar Agarwal sir at AIG, and his initiative Vision 2030, Affordable Healthcare for All, was also one inspiring from FTCCA. But thank you very much Meela Jayadeh sir and Suresh sir and Vishala and Ravi Kumar sir for taking time to visit our center, and hopefully you got convinced enough so that you have given us this opportunity this evening to be in, and also all the FTCCI staff members. So before I start, say let's together make the spine and health movement health as a movement for our healthy life and healthy communities, as our president sir has in his welcome remarks. And also we are here, I mean, to start with this workshop, but would also be equally would like to volunteer and support the FTCCI's Vision 2030 Health Care for All, sir. So it's just not the workshop, and also contribute in a small way. We are starting with this workshop. So without taking much time, I wanted to start with a small story. I mean, I'm a biomedical engineer by training, but as an engineer and standing in front of many industrialists who are the backbone of this country. I mean, the industrialists who are visionaries build the country's economy. So we thought, okay, all the backbones of the country should be taken care with the back health. So, and I worked with many good physicians in Hyderabad and in India, but last 3 years back, we started Asian Spine Hospital, which is pioneering spine endoscopic technology for surgery. Okay, one of the biggest myth in the country and in the world is surgery. If you do a spine surgery, many people think you might get paralyzed after the surgery. I mean, there's a truth to it, but it's not 100%, because some cases have happened, and I can tell you one area where technology making a big difference in surgical profession is endoscopic spine surgery, which is make the surgical more safe and effective, and also trying to address that myth. But having said here, I'm not here for surgery, and as such we have not invented the surgery. It's been there for ages. That's one of the solution when needed, and the right solution when it is absolutely needed. But when we started this hospital in 2021, sir, the team which visited, but I wanted to tell this story to President Garu, how this Ensure Healthy Spine has took birth. Actually, in 2 minutes I'll tell. So when we started our July 1st, 2021, we started the outpatient clinic. We thought there is okay, when the people need a surgery, we'll do it endoscopy. Dr. Nageshwar Reddy Garu was our main mentor, who actually named, our company name is Asian Institute of Spine Endoscopy Private Limited. Then he said, no, put for Asian Spine Hospital, it's a common, there's no spine hospital, at least in the state of Telangana. Okay, maybe not much in India as such. Then let all the spine problem people come to you, then you decide who wants what, based on their need, based on the personalized condition. So then we started on July 1st, 2021, we started our OPD, and it was going on. To our surprise, in the first 3 months, we have seen about close to 600 people, which is more than 200. Maybe looks a small number for an hospital, but it was a very big number than what we expected to start with. And then in 6 months, it was more than 1,000, sir. In the 1,000, we, as a hospital, we started with a purpose, but we always wanted to do what is good for the patient, what is need of the patient, serve the need. So as a researcher and as an engineer, after 6 months when I was looking at the data, and we were only few people, like 20 employees organization. So in the lunch meeting I said, sir, we got about more than 1,000 people to our hospital, and we have done about 100 plus surgeries. What would happen to this close to 90% people? They have come to the hospital with a suffering. It can be mild, moderate to severe, or at the borderline of they may or they may not need surgery. Then he said, most people going out with a prescription of drugs, but everybody saying that you need exercises but not assessed, right? They have identified a problem as a spine surgeon. Then I said, what would happen to them? Then Dr. Sukumar Garu, who is our main surgeon, said, about 30 to 40% of that 90% people would come back, okay, despite they take medicines, because we don't know how they are going to manage or be compliant or be adherence to what they've been told to do. So that actually bothered me. I mean, they're coming here, they've been identified with a problem, and these are all not customers, they're all patients actually. So then I said, sir, why don't we start? And we met with Dr. Subhadra Rani, she's not here, who's our head of yoga and naturopathy. Madam was one of the first one in Hyderabad at Care Hospital, brought yoga into prescription, official yoga for rehabilitation, post-surgery and all. Then she started doing, and people are feeling better. Some of them were directing them to this holistic care. We had yoga center and then pain relief. Then Dr. Suman joined us, who is one of the few sports medicine physicians who understand the movement health as a whole, the musculoskeletal spine and the muscle. The course he was trained in Chennai, and then he happened to know to Dr. Sukumar, and we explained this problem. So many problems is increasing trend in the country, especially in the modern world. Then we said, we have this vision, why don't we, he worked as 2 years as a Kerala Blasters football team doctor. So for the athletes who were more prone for injuries, more prone for more pains and all. So he was well versed with high performance, very high activity people. Then he came because of the family reason, he wanted to stay close to his parents. He said, we discussed this idea, we have a plan, let's start informally. So what we did is, all these 80 to 90% people, sir, literally, we started sending as an hospital to other 4th floor, which you have visited, Sureshji. Then they started doing assessment and all. And then close to 1,000 people were assessed. Close to 1,000 people. Suman would probably talk to it in detail. I'm just giving high level. Most of them are in the age group of 25 to 50 years, who are been at the desk jobs, who have been at that. I mean, above 50, we know certain age, natural aging kicks in, and depending on our professions and activities, we have different patterns and habits and different job profiles. But this was very concerning that majority of them can be treatable. Not the need of medicines has gone down. Okay, need of personalized assessment and exercise has shown as the validation. So we thought, what we thought is understand the people's feedback, right? We are learning. We have not made any conclusion, no decision. In that process, we understood that more than 95% of the people, right, what was earlier had a prescription of medicines and all, once their pain relief is managed, okay, who are doing at desk jobs, who are doing physically demanding, challenging jobs, hard working, heavy lifting, these people started feeling better, sir, started feeling better. Yes, the better pain relief and then. But underlying the root, understanding the root cause was always the main goal for us, which Dr. Subhadra and Dr. Suman and his team now started understanding the underlying reasons, and our observations made me to think these people, they have got the integrative approach as find the solution, because not everybody is going to respond to one therapy, it's a combinational. But assessing them personalized, each individual has its own posture, each individual has its own way of handling the moment, which is consciously and unconsciously we don't know. So that led to, okay, when the 1,000 people data, when we analyzed and all, we found we can do bigger impact than the hospital itself. Okay, I mean, when committed to the mission of affordable healthcare for all, the true affordable is not doing surgery for everybody, is not going to make it affordable. The true affordable is, we believe, is prevention. How do we prevent? How do we understand the personalization care? How do we access the care to all so that we prevent by understanding the root cause? That's where we decided in May 2023, we decided after discussing and more than 6 months with Dr. Suman on board, that's what Ensure Healthy Spine was taken birth, sir, and we incorporated. So let's take it a formal route so that we don't want it to, the philosophically Asian Spine Hospital has focused on one thing. Ensure will focus on the bigger mission, which is more primary preventative for spine and movement health. When we do that focus, we learn more and we understand more the problem, and then we are able to identify the potential solutions and able to scale it also. Okay, the approach of scalability to an hospital to an Ensure Spine would be very different. Two things when we said we'll start working with top to bottom approach. So that's when one of our senior friend connected us to AmSham, and exactly it's 11 months today, July 12th, 2023, we did this first workshop, sir. Today is 11 months, so 33 days you can say when we were saving the file. So on July 12th, the AmCham members, like what FTCCI did, their staff and the members, they organized a workshop like this, sir. And that has really given us the takeoff. Okay, it took into the people, mainly the IT professionals. We did this workshop. But in 11 months, I can tell you this presentation carries a lot of our experiences, lot of our learnings. So it's evolving for the betterment of the people and the society as a whole. So the next slide now. So myself, I'm Naresh, I'm, as I said, biomedical engineering. So that was a story and which was motivated us to get into. Next slide. So what was the purpose? I mean, the why we are here, why we are doing this, very clear. I mean, we all have the good life and all, but for many times we need to be regenerating your spine and our spine and movement health to thrive your active life years and prevent future sufferings. I wanted to say one thing, the spine and the movement is not by disease. primarily the cause of the problems. It is more degenerative. It is more how we care ourselves of our own body and the way how we do our movements more consciously, but we have to be more responsible. Next slide, please. So we always say it's time to prioritize your spine health in the modern working lives. Why? No, thank you. So, I mean, I'm sure, sir, the industry senior people are sitting here, and the management and the promoters and the working professionals across the world. It used to be the 80%, more than 80% of the people at some point in life, they experience an episode of back pain or a neck pain. Neck pain is a new age, more so in 10 years in India, okay, because of the more screen time, more mobile usage. But the back pain is predominantly been age-old issue, but it's popping up more. And with the generations, now we have 3-4 generations in the society, the pain tolerance has also gone down. So the obviously people complaining about back pain has increased. People can, and more than 30 crore of urban Indians experience primarily as a core back pain and neck pain now, sir, which also reflects our data. And then the back pain and neck pain are considered to be one of the main cause of years lived with discomfort. Okay. So that's what disease causes a long-term damage, but the discomfort is this minute, this second, and today. So, which we, in our experience, it says age of 26 to 50 years, and mainly at workplaces. That's why I'm thankful to FTCCI that we got an opportunity to present this in front of the industry senior people, as a lot of industry workplaces under as a members, that this should take. And one of the most common causes which leads to employee sick leave, okay, they may not say I'm feeling sick, it might be back pain. We don't capture the exact data, mainly in India, but across the world, it is one of the common reason why people like to go to a physio or a clinic or an hospital and get some pain relief medicines. That's one of the most common. And when we did across the global survey, it's 25%, 50% of sick leave is mainly because of that. In an age group of 26 to 50. I mean, above 50, we know we have other diabetes, uncontrolled diabetes, BP and all. And what is all leading to, right? I mean, to your affordable health care for all vision, sir. Why? When we try to take out the unnecessary, unsatisfactory management issues, health management issues, obviously where it is burdens on more MRI scans. I mean, I'm pertaining to the spine. The first thing, X-ray or MRI. So unnecessary imaging, right? When you don't identify the root cause, when you don't take it personalized, I mean, quoting Suresh sir, when we go to an hospital, we do checkup, we find something else. But finding the right root cause will avoid many of this. In turn, makes it affordable. And then pain medications and surgeries, right? These are the unnecessary things causing us to have some negative narrative on healthcare as a whole. So obviously when we put it in a system, it try to address some of those. So I wanted to bring these numbers to your attention, sir, especially Ravi Kumar sir, other day I was explaining you. You see, and all the staff members and all, please, we, in our experience directly, 1820, this is in our last 8 months, sir, okay, exact individuals, and I've highlighted these numbers. I mean, it is commonly 977 male, 843 female, and distributed average age is 43. So, but predominantly if you see 20 to 50 years, we have more than 50%. I mean, the numbers are talking, right? So that means much younger, yeah. So, and this is our own individual center experience, numbers. Then what are our observations? I mean, Dr. Suman going to dive you in more clinically, but I going to give you high level. Leg limb length. We don't know. There's a difference on our lengths of both our legs that also might be causing, which will wear and tear our footwear. That's one simple observation. and then the flat foot, which is because unless you observe, it is one of the common thing. Pelvic tilt, that means obviously because of the two reasons. What do you mean all these things? Suman will go. Lateral deviation of the spine, and then muscle imbalances. I think I was explaining to past president sir the muscle imbalances which tend us to sit on one sided when sir was, and the demographic observation. Why? In whom we are observing, females have more upper back and neck problems, and males have more lower back problems. Desk jobs and physically heavy lifting jobs, people are more vulnerable and risk people. Sleeping position. Okay. I mean, I know, sir, we are sleeping, but sleep is not coming. But the posture is also maybe one reason. So, yoga therapy, the naturotherapy, and sports medicine intervention, and the other pain procedures like the form of injections and rarely surgeries. So all these are under one roof where
and lead a happy life.
ensure healthy spine It's time to give your spine the care it needs.
Ensure healthy spine. It's time to give your spine the care it needs.
Ensure healthy spine. It's time to give your spine the care it needs.
Thank you. I mean, that's what the main team members, I think some of the Dr. Sukumar Gar mains, we started this. So, I prepared this slide mainly as a more of a collaboration with FTCCI. What we are saying, healthy spine and healthy minds. As an industry body, we want the people to be healthy, and because when you have spine problem, obviously your mind will be bothered because of your pain or discomfort. So how we are achieving this healthy spine, healthy minds thing is by personalized spine health functional assessment, and then the posture analysis, the back strengthening programs, and corrective and preventive exercise therapy programs, which are actually yielding better outcomes for healthy living, and then also potentially preventing future sufferings. So we thought we get assessed, and then take an action, and then let us be assured of our healthy living. So that's one thing, sir. Then my conclusion slide speaks three things. Friends and colleagues and the industry leaders here, let us care for our spine health. And then we would like to, under Vision 2030, sir, wanted to do a call, a proactive preventive health movement. Okay, in our invitation we said one of the fundamental attitude shift we wanted is shifting from reactive care to proactive preventive care. Let us be proactive. There is I'm quoting, to be careful as a disclaimer, there's a quote, there's a joke, even God says, before seeking moksha, seek your health. So when you want to seek your health, look for your spine health. And it's in BK's Iyengar text also. If you're seeking health, seek for your spine health, because that's what makes our whole structural integrity possible and keep it in turn healthy. So, we say how the Vision 2030 can make it as a movement, which as a healthy life, which we all are seeking, it all starts with a movement. So the movement of our daily activity, and as a movement to revolutionize the shifting of attitude from reactive care, because we all go, when we have a pain, when we are suffering, and a lot of the time we hear, oh sir, you should have come early, you could have done better job in the hospitals. And then as Suman's always says, gym, hitting, cardio, and then hospital, we are saying somewhere in the middle where it's a health. That's why we confine to spine and movement health, which would be the horizontal, sir. Then rest all comes as a vertical pillar. So our proposal and request is, we'd like to, whatever we do, let us take it to at least the working population, sir, in the industry members you have, because they're all breadwinners for their own families, which is male or female in today's world. And also obviously any loss of productivity is a loss to the organization. And there's a clear literature and surveys that people's productivity loss is mainly because of spine health, is one of the, I'm not saying 100%, but it's increasing at an alarming rate. So all the industry leaders, it's part of my introduction, but I want to set the stage, and we could discuss more, and also would like to hear from you also, how we can together make this happen, and so that at least our 20 years, 30 years will not suffer when they become 40, 50. So we have a next 5 to 10 years to shift the gears towards more proactiveness in our day-to-day life. As I said, the top to bottom, my last statement, the top to bottom is, if it can come like a FTCCA type company, organizations can make it as a policy. In your 9 to 5, sir, we say before 9, everybody, each house is different, each lifestyle is different. After 5, we're all running. But in the 9 to 5, at least if you can able to allocate 10 to 15 minutes of the time, saying that we book all our calendars, everything 9 to 9:30, this, at least allocate the 10 to 15 minutes as a proactive measure, where it for healthy spine and healthy life, healthy minds. I think that will make a big difference as a policy or whatever, sir. I'm open to your at your disposal. But this is all the. Thank you for patiently listening and for this great opportunity.